I think compassionate care begins with hope. They know that I am listening, that I understand, that I genuinely care about their family and their child. And it's just tremendously rewarding to see what an impact this makes on these kids and their families. It's just the most rewarding thing that I've ever done.
Kindness is a choice. We all can choose kindness. If we all do that just a little bit, our healthcare system will just be a little bit better.
Helping people at this most vulnerable time of their lives, this most intimate time, really inspires and really brings out compassion and kindness that I didn't know I was capable of. And so I get as much or more out of this work than I give.
I was very honored to have received the award, but very, very mindful that it was not about me. It was about other people who are colleagues doing this work, and first and foremost, the patients who have given us all the privilege to be a part of their lives and to be students on the journey of life with them and through them.
For me, compassion is everything. Compassion is a choice. Compassion is a virtue. It doesn't cost you anything to be compassionate or to give out a small act of kindness. My job is a calling.
It's truly an honor and a privilege to be able to practice medicine. People invite you into their lives at their most vulnerable moments. I genuinely care about their well-being, and to get to be there, backed up by medical knowledge that can help, and then buttressed by the compassion that you can provide, to feel like you're partnering with people at the worst moments of their lives, there's nothing better than that.
Compassion is shared vulnerability, but the vulnerability is the capacity to say, I am going to care no matter how you respond to that care. But I'm going to watch how you respond, and I'm going to adjust my care according to what meets your needs. And so in that process, there is a shared vulnerability, kind of like a yin-yang. We're both putting our hands out to touch each other and meet each other somewhere in the middle. If we lose the human aspect of what we're doing, then we've lost the game, dude.
Winning the Compassionate Caregiver Award had a big impact on my life. It made me realize that between the two elements of science and compassionate care was equally as important as the science of healthcare. Being recognized for something that I was doing every day made me understand how important it was to pass this message to others. It really encourages caregivers to think about compassionate care.
I find in myself the ability to summon compassion by always thinking about what is it that I as a human being would want to be receiving if this were me. It's just a generosity of spirit to want to help another human being in the best way possible. How can I give of myself?
Compassion and caregiver, I think, is a little bit redundant because I think it needs to be so core and central to clinical care that we provide that compassion is just who we are, that I wish we didn't have to say them. But right now you have to say both of those together, don't you? Compassionate caregiver. Open your heart, lean into suffering, and be willing to be changed by what you hear. All of us will be better for it. We can make this world a more compassionate place together.